So here was a study from the UK by Clarke and his group from Manchester, looking at olaparib with abiraterone in unselected patients with prostate cancer. Now, I emphasize the word unselected. Usually when we think about PARP inhibitor, we think about DNA repair, BRCA mutations, and we think that we should be giving this to all patients, to only the selected patients with these DNA repair mutations. So, but this was a study where there's a hypothesis to say that there's some synergy between PARP inhibitors and abiraterone, and that they work together in unselected patients. So they designed the trial like this: metastatic castrate-resistant prostate cancer. One group got olaparib and abiraterone. The other group got just a placebo and abiraterone, and then trying to tease out whether or not there's a survival benefit. Now, early stage study again, but this was the primary endpoint. Investigator-assessed radiologic progression-free survival, and you can see a benefit there. And then, even more interesting, if you look, this is the group. They then separated them out, looking at which patients had mismatch repair, not mismatch repair, sorry, DNA repair mutations. And you can see this was wild type patients that didn't have the mutations. And even in that group, you can see that it appears that the combination of olaparib and abiraterone is providing a benefit compared to abiraterone on its own. But again, we need to be cautious with this. So again, it's early phase data. We don't really know if this is true yet. We need to wait for more advanced data. The group that did this study now, off the back of this study, they're doing a phase 3 trial. But the discussion for this session, he showed, well, there was this study by Maha Hussein looking at a similar question and showing a negative, it was a negative trial, essentially no difference between the groups, using a different PARP inhibitor, olaparib, difference between the trials, but just reminding us that there was also another trial that didn't show any benefit. So again, this is hypothesis, this is interesting. I wouldn't start doing this for unselected patients in my clinic, but we'll wait to see what the trial shows, if there really is some synergy in unselected patients in this setting.